So next up, let's talk about high blood pressure stage 2. This is a bit of a red alert. So this is basically where your systolic is 140 or higher, or your diastolic is 90 or higher. So at this point, damage is accelerating. Your risk of a heart attack, stroke, kidney damage is accelerating quite rapidly. So what should you do? Well, if your doctor doesn't know you get any sort of readings, you need to let them know straight away. But if you do have a hypertension, a high blood pressure diagnosis, almost certainly, most likely, your medical provider is going to start blood pressure medication for you to help lower your blood pressure and reduce your risk. Continue the lifestyle changes we spoke about earlier, and do watch our video on the channel for natural ways to lower your blood pressure as well. And regular checkups with your medical provider to make sure your blood pressure is in check is obviously a really good idea to do, as well as regular home monitoring of your blood pressure. Next, let's talk about hypertensive crisis reading. This is an emergency now, and you need to seek urgent medical advice straight away if you're having readings like this at home. All right, if your systolic is 180 or higher, or your diastolic is 120 or higher, then this really is a medical emergency. At this level, your blood vessels could potentially burst, leading to a stroke, heart attacks, and even death. So the question is, what should you do about it? If you get a high reading like this is your first one, you need to sit down and try and relax for 5 minutes. Next, take your blood pressure again. If at this point it's still high, so remember systolic of 180 or higher, or diastolic of 120 or higher, you need to seek urgent medical attention. Basically, you need to call emergency services. And also, if you're experiencing any chest pain, shortness of breath, numbness, vision changes, or difficulty speaking, do not wait. Seek urgent emergency medical attention immediately.